Hello, my name is Leah, and myself, along with Megan and Delaney, have worked together to create this research proposal. Today, we are going to present our research proposal for family physician burnout. We will begin by discussing burnout as the leading cause of family physician decline, as gathered from our literature review. After providing some background information about the issue, we will move on to our primary research, which consists of a quantitative survey in combination with qualitative interviews. Finally, we will delve into the sociological relevance of the issue, how it affects me, you, family physicians, and the healthcare system as a whole. After reviewing and analyzing current research and literature about family physicians, we noticed that burnout was a common issue among those in the practice. A majority of family physicians are experiencing mental and physical burnout due to the lack of collegial support and increased workload. Mental and physical burnout consequences include depression, depersonalization, disorientation, and chronic fatigue. This has led to a decrease in the quality of work that family physicians provide, as they are prone to making more medical errors, especially with virtual appointments, as they cannot identify physical illness indicators. The burnout and thus decreased quality of work has caused more family physicians to take leaves or retire earlier altogether. This creates a cycle of family physician decline, as early retirement from burnout causes longer wait times for patients to visit family physicians, which results in more family physicians having to execute virtual appointments and decreasing the quality of work.
I just got to work and I know my content is skewing really negative lately. And oftentimes I say to myself, like, you gotta censor, girl. It's getting a little bit dark. And the last thing I want is for this to feel like I'm not grateful for my job, which I am. I love patient care. I genuinely love my job. But when you feel burnt out, and I am burnt to a crisp right now, it's just really hard for it not to affect every part of your life. Like, not only how you feel that day, but your whole mindset going forward. It's affected my appetite, it's affected my sleep.
Our research question is focused on looking at how burnout affects the quality of work of family doctors, leading to an overall decline in the field. We will be using a mixed methods approach. This methodology allows us to integrate a quantitative survey with qualitative semi-structured interviews in an effort to gather a more holistic set of data. We will be using a mostly deductive approach as we are using the systems theory to inform our work. However, we will be using the iterative research process so we can move between data and theory to build an existing ideas. To get a general understanding of the issue and to pick participants for the semi-structured interview, we decided that a quantitative survey would be beneficial. Our quantitative survey consists of 7 questions, with the final question asking the individual would be willing to participate in an in-person interview. In this way, we are doing a purposeful sample as we will be looking specifically to interview those family physicians who are experiencing burnout. Furthermore, we have created a semi-structured interview guide that outlines 4 questions with probes that are relevant to how family physicians are experiencing burnout within their field of family medicine. Using a semi-structured interview, will allow for individual experiences and voices to be valued.
Burnout affects family physicians mentally and physically at the micro level. This affects the wait times and quality of work in the healthcare system as a whole, therefore affecting patients who are in need of care but not being able to receive it due to the shortage of family physicians. In this way, we are able to see how the issue occurs in a cyclical manner. What happens in each level influences the other levels, therefore emphasizing the interconnectedness of the system. A systems theory approach can be used as a framework to help explain how the micro and macro influence each other. Systems theory is a grand theory, which means that it cannot be tested directly, but rather can be used as a framework for research. Using a systems theory is important because it allows us to analyze this issue from a holistic perspective. Instead of blaming individual family physicians for their burnout, it is crucial to understand the broader factors that contribute to and are consequences of the burnout experienced. C. Wright Mills describes the sociological imagination as the ability to see how the micro level affects the macro level and vice versa. Sociological imagination is an important consideration to ensure that the research is applicable to greater contexts. Our research aligns with the sociological imagination framework as we will be examining both the micro and macro levels that influence and are influenced by burnout experienced by family physicians. Our research can provide us with knowledge about the social world, more specifically knowledge about healthcare and burnout, that can inform policies and procedures for family physicians that will improve the healthcare system. For instance, providing more social support and benefits for family physicians, such as group therapy or improved conditions around paid leave. Leah and others in their research article emphasize the importance of using proactive strategies rather than reactive strategies. In order to use proactive strategies, it is necessary to be informed about specific issues that family physicians face and what the impacts of those issues are. This is why our research is relevant to both micro and macro structures as it can be used to improve healthcare system as a whole. For further research, we recommend that researchers interview family physicians who have not experienced burnout and collect data about the coping mechanisms that are commonly practiced among them, as this may be able to help other physicians who are also experiencing burnout.